Company behind CoolSculpting and the system claiming she has been disfigured. That's a picture of her from more recent times. This is one of the very, very few images that you can even find of her on Instagram, and that's from 2019. She put out a statement on Instagram saying that she had this procedure, and while her peers have been out there modeling all over the place, she hasn't been seen because she feels disfigured. That she did this procedure and the fat cells increased instead of decreasing, which is why you would get this. She said she was never made aware of that risk. She had 2 corrective surgeries, unsuccessful, she says, that have left her unrecognizable. So we needed 2 guests for this one to bring it all down and to explain it to us. Attorney Heather Hansen and also our board-certified plastic surgeon, Dr. Stephen Davis, who does use the CoolSculpting in his practice, but is not paid by them or have any sort of relationship with the manufacturer or consult with them as well. So I'm going to start with you, doctor, because it's fascinating. I certainly have heard of the CoolSculpting, and it's the one where they freeze it all and then it leaves it like a stick of butter. I know many people have had it. I had never heard of a problem. That's why this is so surprising. But this is something that is a real risk and can happen.
Absolutely. And you know, when patients come in and they really are setting themselves up to have some kind of a cosmetic procedure, we always go through the potential risk complications, and they sign a consent form that says that there is a sense that certain patients will develop something called PAH, which is paradoxical adipose hyperplasia. And it's very, very rare. It's less than 1% of everybody that's had a CoolSculpt procedure, and there's been over 11 million of these performed. And it's a chance that that area that gets frozen, instead of going away, the fat cells kind of increase.
So the question is, like, why would you do it? The reason why people do it is because it's extremely successful. Most of the time it works, except for the few times when it doesn't. So when it doesn't, which is horrifying, how do you know that you could be at risk for this? You don't?
You don't, and that's the issue. And that's why the company even says that if you should be the one that gets this, they're going to pay to have it treated. And you can treat it with liposuctioning. And I've had a few patients that were actually sent to me that have had it done elsewhere, and the company sent them to me, and I actually did some liposuctioning, and we resolved the issue.
So you fixed the problem for 2 different times in your practice. In all the years you've been doing, you've had these 2 instances where this happened. All right, so Heather, on the attorney side of this one, I mean, she was one of the biggest supermodels of the big 3. We knew her from every magazine cover. She fronted every single major campaign. She walked every single major thing. And all of her peers are working. We see them all over the place. Here's all the women that she was with during these times. So she's not a normal human to have a case like this being like, you have disfigured me. What do you think?
Well, what happens is we see these risks, and she knew about the risk. According to the complaint, she signed a consent form that said that there's a risk you're going to grow fat where they took the fat away.
I sign those things all the time for like Botox. I don't think it's going to happen. Like, you don't think it's going to happen to me.
Well, that's the thing. The risk isn't a big deal until it happens to you. But when it does, it's really not anyone's fault. There are things that happen. Everyone does everything perfectly. Now, she hasn't sued the doctor. She only sued the manufacturer of the machine. And that's interesting because the manufacturer of the machine doesn't talk to her directly. They talked to her through the doctor, and the doctor did discuss the risks. So I think she's going to have a difficult time here. The advice for the listeners, the watchers, are that you should really know about these risks, weigh them against the benefits, and be willing to ask your doctor questions about how often does this happen? Could this happen to me? What happens if it happens to me? And be really well informed before you do any sort of procedure.
Now, normally there's a statute of limitations. We're past that. So what do you think that means to you reading the legalese, like tea leaves?
Yes, that's a time in which you can sue, and that's usually 2 years. It's more than 2 years. It usually means that they've been in discussions, and that's my impression from reading all of this, that she's been talking to the manufacturer, trying to resolve this. And maybe sometimes they say, okay, we'll extend that time so we can see if we can resolve this. But they couldn't, so she filed this suit. That's my assumption.
Do you think they're going to settle?
I mean, listen, I would normally say yes, absolutely. But the fact that this seems to have been in conversations before, it may be that everyone's in their corner, not willing to sort of compromise, and so it may take a little bit.
Your advice for people that come in saying, you know, I might have a little bit, you know, that might be nice to get that removed. For the most people that you treat, this has been very successful.
Very successful. And again, you want to go to an office that continues to do continuing education. I know we just recently sent one of our medical associates to what they call CoolSculpt University. There's actually a university where they keep up on all the latest trends.
Because things evolve and all the things,
constantly.
even with Botox, who knows if you're actually getting Botox, there's been like 25 products since then, so
Absolutely.
things evolve and it's
right.
good to
and
be
ask questions
informed.
and make sure that you know all the risks.
All right, I'm going to have to stick to my diet and exercise. All
Yeah,
right,
yeah,
thank
that's
you,
always
doctor.
good.
Thank
That's
you,
always
Heather. We
good.
really appreciate that one. Still ahead, let's talk about Britney Spears, the documentary making